Hello, my name is Myrene Guevara. I will be discussing my presentation regarding contraception and family planning. What is contraception and family planning? Contraception and family planning are methods used by both male and females in order to avoid an unplanned pregnancy. This is done due to a number of reasons. Unplanned pregnancy causes a higher health risk for both mom and the baby. This could be due to mom not being financially, mentally, or physically ready in becoming pregnant. It could also be because the individual or couple may want to space out the age of their children. Maybe it is a personal preference that the individual or couple may want only a certain number of child or children, or that there is physical space limitation in their current living environment. Another reason why a couple or individual may want a form of contraception is because they are currently having a health issue that places the individual or potential infant at risk. I will be discussing the different birth control methods with this presentation. The first method that we will be talking about is called coitus interruptus. This is also called the withdrawal method. This method involves pulling out of the vagina before ejaculation. This method prevents pregnancy as the ejaculation containing the sperm will not reach the egg to fertilize it. This method will need both sexual parties to have greater self-control to pull out before the ejaculation. With this, there is 20% risk that the female may become pregnant, especially with the males releasing pre-ejaculation fluid in the vagina while having sexual intercourse. The advantages for this method are that there are no health risks or side effects, as this method does not involve any medication and is only involving self-control. This method is free and does not involve any cost and may be used by breastfeeding individuals. The disadvantages to this method are that this method will not protect both parties from contracting sexually transmitted infection. It is very unreliable birth control method and will need a higher self-restraint and control by both parties. Postcoital douching is rinsing of the vagina after sexual intercourse. There are different agents that may be used, such as water, vinegar, a mixture of both water and vinegar. Feminine hygiene products are used to flush out the semen and sperm out of the vagina after having sex. This form is a very unreliable form of birth control, as the sperm may be able to enter a female's cervix in a matter of seconds after ejaculation. This will also not protect and prevent sexually transmitted infection for both parties, and certain products may cause irritation or infection of the vagina. The advantages to this method are the same as the previous one, where there is little or no cost, as this is free. It also does not have any other side effects unless the female has any sensitivity to the douching agent. Lactational amenorrhea is a specific form of birth control in which all of these factors must be met. You can only use this method if, number 1, it has only been less than 6 months since the individual has given birth. Number 2, you have no menstrual period. And number 3, you are breastfeeding your infant exclusively every 3 hours or whenever your baby is hungry. Once the baby is eating solid foods, this method may not be reliable to prevent pregnancies. How does this method work? When a female breastfeeds, she releases certain hormones to prevent the eggs to be produced. Pumping milk using a breast pump does not count. The advantages to this method are that it can be used immediately after given birth. It is very efficient and free of cost. The infant benefits from the breast milk of mom, And the disadvantages to this method are that it is only effective when all of the three conditions are met. The mom being less than 6 months after giving birth, not having any menstrual period, and the infant is exclusively breastfed. Because of this, this method does not apply to anyone who may want to use this method, and it may be an inconvenience to breastfeed the baby, especially if mom is working. It also does not protect or prevent sexually transmitted infection. The contraindication to this method is that some certain mothers are not allowed to breastfeed because they have a certain illness or is currently taking medication that may be present in the breast milk, so that she may not be allowed to breastfeed her infant, or if she has a medical condition such as HIV that may transmit the disease from mom to baby, then we would not recommend this method. Male condoms are barrier sheets made out of latex, polyurethane, or lambskin intestine that prevents the sperm from entering the vagina. Think of it as a penis cover that prevents the semen from entering the vagina. How do you use it? Open the condom package carefully, not ripping or tearing the condom. Place a condom on the tip of an erect penis, pinch the top, and roll the condom down the base of the shaft. After use, before pulling out of the vagina, hold the condom at the base, withdraw slowly, and discard in the trash. The benefits for using latex and polyurethane condom is that it is an effective protection against sexually transmitted infection that includes HIV as well as preventing pregnancies. Using condom has little to no side effects. It is very economical and inexpensive, and this method may be used with other birth control methods. Another benefit to using male condom is that you can purchase it without any prescription, or anyone may buy them. The disadvantages to using male condoms are that lambsika or intestine may be less effective in preventing sexually transmitted infection that a latex or polyurethane condoms may be. Condoms may have manufacturing errors that may decrease the effectiveness, such as breaks or tears from manufacturing. It can also be stored incorrectly, such as placing it in the wallet that may cause the condom to be brittle and break while using. Oil-based lubricants may be used, and this will cause the condom to break and be ineffective. A condom should never be reused, so it's only a one-time per condom use only. And the absolute contraindication to latex condom is having latex allergies. Female condoms are loose pouches made out of polyurethane or nitrile with two rings on both ends and is inserted into the vagina prior to sexual intercourse. It is similar to a male condom where it acts as a barrier between the semen and the vagina. How do you use it? You can place a female condom for up to 6 to 8 hours prior to having sex. Open packaging carefully, making sure not to cause tears in the condom. Squeeze the inner ring and insert it into the vagina. The smaller ring stays inside the vagina while the outer ring covers the outside of the vagina. After sex, twist the condom and pull it out to discard in trash. The advantages to female condoms are that it is an effective method for protection against sexually transmitted infection and pregnancy if used correctly. Use of this has very to no little side effects at all, and it is safe for use especially in individuals with latex allergies. The condom may be used with both oil-based or water-based lubricants. The disadvantages to the female condom are that some people prefer not to carry this as the packaging may be bulky and expensive. Use of both female and male condoms together may cause breaks and tears that may make this method ineffective and, like male condoms, manufacturing errors or improper storage may cause this birth control method to be ineffective. A vaginal diaphragm is a rubber cap that covers the cervix and around the vaginal wall to block sperm. This may be used together with a spermicide cream or gel to increase its effectiveness in prevention of pregnancy. How do you use it? Apply spermicidal cream or gel around the inner curved side. Insert into the vagina 6 hours prior to having sex. You may leave it for up to 24 hours after sex. The benefits for using the diaphragm are that it may be placed up to 6 hours ahead of time before sex. There are very minimal to no side effects, and that the woman who does not want to rely on their partner for birth control may use this method for pregnancy prevention. The disadvantages to this method are that this will not protect both parties from contracting sexually transmitted infection. A diaphragm must be fitted by a physician or a trained healthcare practitioner with yearly evaluation to make sure that the diaphragm is the correct fit and creates a tight seal around the vaginal wall. This method is not recommended for women with a relaxed vaginal wall or pelvis, short vagina, or women with certain positions of the uterus, such as inverted uterus. A diaphragm may not be used while you are on your period, and it may not be used with oil-based lubricants or oil-based silicone lubricants. Using diaphragm may increase your risk for having UTI. This method is contraindicated with women with latex allergies or if less than 6 weeks after giving birth, having a miscarriage or an abortion. A diaphragm is contraindicated with patients with history of toxic shock syndrome, which is a life-threatening condition causing the body to experience shock symptoms such as low blood pressure, rashes, vomiting, diarrhea, an extremely high fever, confusion, and seizures. A cervical cap is similar to a diaphragm in which it covers the end of the vagina, preventing the sperm and semen to enter the uterus. It is similar to a diaphragm, however, it only covers the cervix, which is the end part of the vagina, rather than the vaginal wall itself to block sperm. Its use is similar to the use of the vaginal diaphragm, in which you have to use a spermicide gel or cream and place it on the inner cap and position it correctly in the vagina to cover the cervix. It has to be tightly covering the cervical wall, and it may be difficult to place. The advantages to using a cervical cap is that it can be placed to at least 6 hours ahead of time, and that there are very minimal to no side effects at all. It also gives the women more independence in pregnancy control and can be worn up to 48 hours in the vagina. The disadvantages to using a cervical cap is that it does not protect and prevent against sexually transmitted infection, and it is very difficult to find the correct size of the cap that fits the cervix tightly and properly. So a lot of female may not put the cap in the correct position, and this may cause a higher failure rate if it is positioned wrong and may cause pregnancy. Having the cap in for longer than 24 hours may cause a foul odor in the vagina and may cause infection. It is contraindicated with women who just given birth 6 weeks prior, who had an abortion or miscarriage, and it is contraindicated for women with cervical cancer. It's also contraindicated like the vaginal diaphragm with history of toxic shock syndrome, which increases the risk if it is left in the vagina for greater than 48 hours, and it also increases the risk for the women getting urinary tract infections. Spermicides are creams, foams, gel, suppository that kills and destroys sperm upon entry to the vagina. This can be used by placing the spermicide into the vagina, and it prevents pregnancy by stopping and killing the sperm and preventing the sperm to enter into the cervix. Spermicides can also be used with diaphragms, cervical caps, condoms for added effectiveness. The active ingredient of spermicide is non-oxynol 9, which is called N9, which is a chemical that kills the sperm. And the application of a spermicide is the first thing to do is to insert the spermicide, either a foam, a cream, a gel, a suppository, a tablet, into the vagina 1 hour before sexual intercourse. The spermicide should not be rinsed out after sex and should remain in the vagina up to 6 hours. The advantages of using spermicide in pregnancy prevention is that it can be used with other barrier birth control methods such as diaphragms, condoms, cervical caps to increase the effectiveness, and that it may be used without the need for a prescription, and that you can use it ahead of time 1 hour before sex to prevent pregnancy. The disadvantages to using spermicide is alone by itself, it is very ineffective and it has a failure rate of 15% to 29%, and that certain chemicals in the spermicide may irritate the vaginal walls and cause wounds and lesions that may increase the risk for HIV. It also does not prevent against sexually transmitted infection, and it is a higher risk for HIV for patients with greater risk for HIV, so it is contraindicated. A cervical sponge is a cap-like sponge material made out of polyurethane or like a soft plastic foamy material that covers the cervix, and it contains a spermicide that kills the sperm prior to entering into the cervix. It has the same active ingredient as the spermicide, which is the non-oxynol, and what it does is it kills the sperm while it passes through, or while it attempts to pass through into the sponge. How do you use it? The sponge should be wet with water, and it should be inserted into the vagina. It may be placed into the vagina 6 hours prior to having sexual intercourse, and it should be left into the vagina for about 6 hours after use, and that it could stay in the vagina for a total up to 30 hours. Leaving it into the vagina for longer than 30 hours increases the women's risk for having toxic shock syndrome, which was discussed earlier as a shock symptom that is life-threatening. The advantages for using cervical sponge is that there are no prescription needed, and that it could be placed ahead of time up to 24 hours prior to having sex and can be worn for a total of 30 hours, and that it gives women the control to prevent pregnancy on their own without relying on men, or that it could be used with a male condom as a backup method to increase the effectiveness of preventing pregnancy. A cervical sponge is 91% effective on women who have not been given birth. However, one of its disadvantages is it becomes less and less effective, about 80% on women who have already given birth in the past. Another disadvantage for a cervical sponge is that it does not protect or prevent against sexually transmitted infection, and that the spermicide chemicals in the sponge may cause irritation of the vaginal wall. One of the contraindications to using a cervical sponge is for women with a history of toxic shock syndrome, women with a history of cervical cancer, women who are at high risk for getting HIV, and who have allergies to latex and polyurethane. The risks are higher for getting UTI with a cervical sponge, and the risk of getting toxic shock syndrome for having a cervical sponge in the vagina for more than 30 hours increases the risk. The intrauterine device, or an IUD, is a T-shaped small device that is placed into the woman's uterus to prevent pregnancy, and it is placed by a healthcare professional or a trained healthcare provider. There are two types of IUD: the copper IUD called Paragard, and levonorgestrel, which is a hormone IUD called Mirena or Skyla. The copper IUD does not contain any hormones, and the LNG or the levonorgestrel contains hormones. The way that the copper IUD works is there are copper wires surrounding the IUD device, and copper kills sperm. So whenever the sperm attempts to enter the woman's uterus, it gets killed, and the hormone IUD secretes little bits of hormone which changes the walls of the woman's uterus and prevents pregnancy. The copper IUD is also used as an emergency contraception for people or women who have unprotected sex and do not want to get pregnant. Then they can have the IUD placed, and this will prevent any of the fertilized eggs from sticking into the walls of the uterus and prevents pregnancy. The benefits of getting an IUD is that on the long term run, it is a very, very effective, safe, and cheap method of birth control. It is best for mutual monogamous relationships, and that it can last from 3 years to 10 years so that women do not have to worry about obtaining another birth control method. One of its consequences or disadvantages is that copper IUD may cause very, very heavy menstrual bleed for the first 6 months. The IUDs does not protect against sexually transmitted infection, and that it gives a higher risk for pelvic infection for the first 20 days once it's placed. Another disadvantage for the hormone IUD is that for the first 2 weeks after it is placed, it might not be effective yet. So, another barrier contraceptive needs to be used while it is in place. The patient needs to be educated that when they have severe pelvic pain, if they are missing the IUD string in the vagina, if they are having severe vaginal bleeding, if they're having any fever, any discharge from the vagina that smells, or have any possibility of pregnancy, to contact their healthcare provider. The A vaginal ring is a small, tiny, flexible ring that contains hormones that is released steadily into your body, that is worn 3 weeks out of the month. And this hormones that is released into the body helps prevent pregnancy. The main hormone in the vaginal ring is mainly estrogen, and how it is used is that you can squeeze the ring with your fingers, gently push it into the vagina, and that for the first 7 days, you need to use a barrier protection such as a condom because the hormones has not released the concentration that will help prevent pregnancy. Once the hormones are in the system, then what happens is the body does not release the egg, and it also changes the walls of the uterus so that a fertilized egg may not be implanted to cause pregnancy. Since it is going to be left into the vagina for 3 weeks, you only use it once a month, which makes it very convenient for the female and make it very easy to use as a birth control method. It is to be removed on day number 21 to day number 30, and once it is removed, the women may get some spotting or their period. And while the patient is on the vaginal ring, she needs to understand that if the ring comes out for about more than 3 hours, that she needs to use a different form of birth control, such as a condom, because this may cause pregnancy. The vaginal ring, if used correctly, is very effective. It has a 91 to 97% effective rate if used correctly. Also, because the ring has some hormones, it may have some good effects on your body, such as having lighter period, having less acne, having less cramps, less PMS symptoms, and generally it is safe to use. Its disadvantages is that it does not protect against sexually transmitted infection such as HIV. The ring needs to have another form of pregnancy protection for the first 7 days of use, and that it must be removed on the fourth week and have a new ring placed every month. You cannot obtain a vaginal ring without a prescription, so a visit to a healthcare practitioner to get a prescription for the vaginal ring. Its disadvantages is it since it has some hormones, it may cause some hormonal changes in your system, so that females with a higher risk for blood clots, who are 3 to 6 weeks after giving birth with and without breastfeeding, women who have heart disease, diabetes, high cholesterol, who smokes, who have high blood pressure, who have a history of stroke or at high risk for stroke, who have liver disease, breast cancer, and history of toxic shock syndrome are contraindicated in using the vaginal ring. The contraceptive implant is a 4 centimeter small plastic rod that looks like a match that is placed under the skin of the upper arms. And what it does is it contains hormones called progesterone, which helps prevent pregnancy. So the hormone of progesterone, what it does is that when it is released into the system by this tiny rod, this implant, it causes the uterus to become thicker, and so that the sperm has difficulties to reach the egg, and that the environment of the uterus is not the best environment for the fertilized egg to be implanted, so this prevents pregnancy. The implant is 99.7 to 99.9 effective in pregnancy prevention, and it can last up to 3 years. How this implant is placed, it has to be placed by a healthcare provider, a trained healthcare provider, and a physician, or a physician, sorry. And placing it, the healthcare provider may inject numbing medication so that uh, it won't hurt, and that it is inserted with a needle. And it may take up to a week or two for the implant to start becoming effective. So for the first 2 weeks, the women is advised to use a barrier protection, either a condom or any other birth control method, to help prevent pregnancy. The disadvantages for having the implant is that it does not protect against sexually transmitted infection, and that the woman must remember to come and make an appointment every 3 years to have the previous implant removed and to replace it with a new one if they do not want to get pregnant, or that she must go to a healthcare provider if she's planning on getting pregnant to have it removed. Since the implant has some hormones in it, it may cause some side effects such as cramping and then irregular bleeding or spotting. The women may also experience gaining weight, soft, painful breast, and abdominal pain or pelvic pain. The implant is contraindicated in pregnancy and for people with heart disease, diabetes, high blood pressure, high cholesterol, who excessively smokes, who has a history or at high risk for stroke, severe liver disease, and breast cancer. A trans Emergency Oral hormonal contraceptives are oral pills that are taken by mouth on a daily basis to help prevent pregnancy, and it is also called birth control pills. There are many kinds of birth control pills, so please look into the packaging on how you're supposed to take it, as there are certain ones with specific instructions and directions. So, generally, the way that birth control pills work is um, these pills contain hormones, and there are two types of birth control pills. One is a combination of the two hormones of estrogen and progestin, and there's also another pill which is strictly progestin only and it doesn't have any estrogen. The combined pills works differently than the progestin pills. How the combined pills work is that it prevents pregnancy by preventing your body from releasing the eggs, and it also causes the lining of the uterus to be thick Sorry, no, it makes the lining of your uterus to be thin and the liquid coming out of the vagina, the mucus, to be thicker so that the sperm would not be able to move around and fertilize the eggs. The progestin pill is also called mini pills, and what it does is it thickens up the mucus. And it also thins out the lining of the uterus so that the sperm would not be able to pass through the liquid and not implant on the uterus. So it also prevents pregnancy that way. Generally, how to take the oral pills is the combined pills, the combined hormones of the estrogen and progesterone. There are 21 pills, and one pill is taken every day until you reach the 21st pill, and then they would have 7 pills that have no ingredients that are placebo pills, and so that while taking the placebo pills, you get your period. The progestin only pills or the mini pills come in 28-day active pills. Now, in order for these pills to be effective, it needs to be taken daily at the same time every day. The benefits for using oral hormonal contraceptives or taking birth control pills is if taken correctly, it is 97% effective in preventing pregnancy. If taken incorrectly or not at the same time on a daily basis, or if you miss a dose, it goes down to 91%. Taking the pill is easy to use. It's taken orally with water. It can be used with other forms of birth control methods such as condom or other um, barrier birth control methods without the hormones, and it also may result in regulating the menstrual cycle of the female. So if a female has a regular menstrual cycle, this may regulate her menses. It also has hormones that has shown to decrease acne and decrease PMS or premenstrual symptoms. So a female may benefit from having lesser cramps, less blood loss, and prevents certain risk of cancer. The disadvantages to the pill is that a female needs to be compliant on taking the pill every day at the same time in order for it to be effective. It will not protect against sexually transmitted infection, and its effectiveness will be decreased with other medications or herbal formulations such as St. John's wort. It may decrease its effectiveness when taken with other antibiotics or anti seizure medications. Because the pill has some hormones, it does have some hormonal side effects such as nausea, vomiting, abdominal pain, headache, irregular menses, breast pain and tenderness, and headaches. Contraindications to oral hormonal contraceptives are women who are breastfeeding, who are 6 weeks after giving birth, who are higher risk or had history of blood clots either on the legs or in the lungs, history of stroke, history of diabetes, cigarette, tobacco smokers, heart disease, with history of high blood pressure and severe liver disease. The progesterone only pill or the mini pill are more suited for women who should not be able to take estrogen, such as older women who are smokers with a history of migraine, with severe headaches, with high blood pressure, with a history of lupus, and who are breastfeeding. Injectable contraception are birth control injections or birth control shots that are injected into the muscle, and that it contains hormones that help prevent pregnancy. So these hormones prevent the egg from being released, and it also causes the mucus of the vagina to become thick so that the sperm would not be able to swim up into the cervix to reach the uterus. It also causes the uterus lining to become thin so that just in case there's a fertilized egg, it will not implant into the uterus, thus preventing pregnancy. Now, this injection is also called Depo-Provera, and one injection lasts up to 3 months or 12 weeks. The benefits of the birth control shot is that it is 99.7 effective in preventing pregnancy. And since it is given only once every 3 months, it can only be given about 4 times a year, which is makes it a low maintenance form of birth control. Since this medication contains hormones, it may affect the menstrual cycle. So some women may experience not a lot of bleeding or no periods at all. It also has an effect of decreased PMS or premenstrual symptoms, so not a lot of heavy bleeding and lesser menstrual cramping. The disadvantages to the birth control shot is that it will not protect or prevent against sexually transmitted infection, and it needs to be given by a healthcare professional or a physician so that once every 3 months, the female needs to schedule a visit to get the injection. At the same time, she will need to remember to schedule that visit once every 3 months so that it would increase the effectiveness of the medication. Because the injection is a long term hormone, it may cost longer to become pregnant once you stop the injection. So that it is important to know if you're planning on getting pregnant within the next couple of months, make sure to talk to your healthcare provider so that you can think about using a different form of birth control other than the injection. One of the side effects to the birth control shot is that the longer you take it, if it's greater than 2 years, the lesser your bone mass would be, so that if you are at higher risk for getting fractures or you are involved in an activity with higher risk of fractures, just be aware that it does thins out your bone the longer you take it. So maybe calcium would help while you're on this birth control method. Some of the side effects with this birth control shot is that it may cause nausea, vomiting, abdominal pain, headache, irregular menses or bleeding. It may cause weight gain and some bone thinning. The injection is contraindicated with women with breast cancer, severe liver disease, diabetes, high blood pressure, heart disease, seizure medications, or lupus. The calendar method is one of the natural family planning method that does not use any medication or any drugs in order to prevent pregnancy. This is used by women with regular menstrual cycle from days number 26 to days number 32 who regularly have their period every month with the same frequency of days. And this method works by avoiding pregnancy or having unprotected sex or using other birth control methods on specific days. And in order to calculate the days in the calendar, method is you need to know how many days your regular menstrual cycle is, whether it's 26 days, whether it's every 27 days, up to 32 days. And on day number 8, after the first day of your period to day number 19, is to avoid having sex or use other barrier methods to prevent pregnancy on day number 8 to day number 19. And the advantages to using the calendar method is that there are no side effects since you're not taking any medication or hormones, and that it can be used when a female is trying to get pregnant. It is very economical, it is actually free, and it can be combined with other natural family planning methods to increase its effectiveness. It also helps the female being able to be aware of their bodies, knowing when they ovulate and when they are able to have sex without getting pregnant. The disadvantages is that it is not a reliable method alone by itself. It has a 35% failure rate, and that it does not protect against any sexually transmitted infection. It needs a daily monitor. So the female needs to keep track of the days that she is um, not fertile or not able to get pregnant. There are days when she could get pregnant, and she needs to be aware of that. Now, because this method relies on the regular menstrual cycle days, for women with conditions where they have irregular menstrual cycle, this may not be as effective to prevent pregnancy. The temperature method is another fertility method that uses natural family planning. And the temperature method is used to predict the times when the body releases the egg, so that once the female is able to predict when the egg is going to be released, then they can avoid having unprotected sex for those days, and this way they can prevent getting pregnant. So this method is used by measuring the temperature daily every morning and graphing or documenting the temperature and monitoring the rise of temperature. So the way to keep track of when your body will release the egg, which is also called ovulation, is when you document your body temperature, and then there will be a slight drop of your body temperature and then increased, and it will stay increased on a higher temperature, and that means that your body have released the egg and that you are no longer ovulating. So, for instance, let's just say that you are on a normal cycle of 28 days, and on day number 13, you noticed that your body temperature dropped when you measured it that morning, and then on day number 14 it's dropped, and then on day number 15 and 16 it goes up, meaning that's the time that you are releasing your egg. So day number 16 and day number 17 and day number 18, 3 days after your temperature increased, is when you should avoid having sex, so that you would not get pregnant. Now, the benefits to doing the temperature method is that there are no side effects. You are not taking any medication or hormones that prevents pregnancy. This method may also be used in predicting when your body usually ovulates, so that when you are trying to get pregnant, you know the times when you are releasing your egg. It is very economical, it is inexpensive, and it is free. And this method may also be combined with other natural family planning methods in order to prevent pregnancy. The disadvantages for this method is that it could be inaccurate. There are certain situations where your body temperature goes up and down depending on how your body acts. Maybe you are having a fever, maybe you are not able to check your body temperature at the same time every day, so that will um, kind of show a little bit of changes with the normal body temperature that you're supposed to take in the morning, or that you are having very irregular cycle, and that it is difficult to predict when you are ovulating, since you would have to go back and look into the calendar and look at the days when your temperature drops and your temperature spikes up. It could be after the fact. Like, you have to go back and re-review your graph in order to see the times that you are able to have sex. It has to be 3 days after the highest temperature rise. The combination of the temperature and calendar method is another way in order to prevent pregnancy. This uses both the data recorded for the temperature method and the calendar method in order to keep track of the days when your body is releasing the egg, in which you are more likely to get pregnant. If your cycle is regular and if you have been consistently taking your body temperature at the same time every morning, the failure rate for this method is about um, 5%. The benefits for using this method is you don't generally have any side effect. You're not taking any medications or hormones to prevent pregnancy. It is inexpensive and it is very economical. It is free. It also may be used for women who are trying to get pregnant and may combine this method with other naturally family planning methods for people who are or have religious or spiritual beliefs that prevents them from using any barrier or hormone contraceptives. The disadvantage to this method is that the data could be not accurate, so that it increases your likelihood of getting pregnant, especially for the ones who are not keeping track of their cycle days and their temperature at a consistent time and at a daily frequency. Um, this method will not protect you against any sexually transmitted infection. You need to be motivated enough to um, document your daily temperature and your menstrual cycle, and that for women who have irregular cycle, it's very difficult to use this method. It decreases its accuracy and may increase the risk of pregnancy. The cervical mucus method is another natural family planning method in which the female needs to monitor her vaginal fluid's consistency to predict when she will be releasing her eggs. Um, the way that this works is that female the female's hormones affect the consistency of the vaginal fluid. So if the vaginal fluid is dry and sticky, and this is usually after menses or after her period, then she's not ovulating. When the hormones um, goes up to stimulate your body to release the eggs, the mucus or the liquid of the vagina becomes wet and watery. And when it becomes to the consistency of an egg white, where it is clear and stretchy when you touch your fingers, um, together, then that means that your body is releasing your egg, making it easier for the sperm to pass through that stretchy vaginal fluid so that it can fertilize the egg. So the theory is to avoid having sex when the vaginal fluid becomes the same consistency as the egg white. The advantages to this method is that there are no side effects, that there are no hormones or no medications that are being taken. So it is inexpensive and very economical. This method may be used when the female or the couple is trying to get pregnant, and this method can be combined with the calendar method and or the temperature method in order to predict when the body will release the egg to either become pregnant or avoid pregnancy. The disadvantage to using this method is that if the data is not um, monitored correctly on a daily basis, that this could be not accurate. This method will not protect against sexually transmitted infection, and that the female needs to understand her body and the consistency of her mucus in order to predict when she will be releasing her eggs. There are also certain medications or conditions where the vaginal fluid can be affected. Certain medications, such as antibiotics or medications that um, dry out the vagina, such as Benadryl, may change the consistency of the vaginal fluid, so this may affect the results of the monitoring. So the results might not be accurate, and this may cause pregnancy. Symptothermal method is another natural family planning method in which this method uses the female's symptoms as well as the patient's body temperature in order to predict her fertile or her times when her body releases her egg. This method may also use other hormone strips, the one where you urinate into, to predict when you are releasing specific hormones to check if you are ovulating or if you are releasing your eggs. So, this method usually needs to be monitored very consistently and needs a lot of commitment, planning, and calculation. Um, you need to be able to know the days that you start your period, the day you end your period, to take your temperature on a daily basis every morning, to check your cervical mucus, to sometimes check your hormones by peeing on a strip, and looking into the graph or a program to see when you are more likely to get pregnant. So, an example of this is this picture right here, in which it documents the day of the cycle. And it looks like this person has 31-day cycle. The female checks on the mucus consistency, on how thick the mucus is, checks on the temperature, on where the normal temperature dips and rises to see when the fertile period is, and also check on the position of the cervix, or when you put your finger and know if your vagina is have a higher cervix, a lower cervix, to evaluate when you will be releasing your eggs. So the benefits for using this method is that there's no side effects, there's no medications, there's no hormones. It is very economical, it is free, and it can be used when trying to become pregnant. um, Another benefit for this method is that this makes the woman more aware of her body and be more aware on when the chances of you getting pregnant. This also increases and makes better communication between the couple. And this method may be used um, after giving birth or while trying to become pregnant. The disadvantage to this method is that it needs a lot of commitment and consistency in gathering the information, making sure that you document everything accurately. This method will not protect against sexually transmitted infection. And if the female is using any hormone strips, this may get expensive. Surgical sterilization is also a method where you go through surgery to prevent pregnancy. This method usually is called a vasectomy for males and tubal ligation for females. There are also other certain surgeries where the female's uterus or ovaries is removed due to certain conditions or situations, and this will prevent pregnancy. The benefits for the surgical sterilization is that it is 99.5% effective, and then after the surgical procedure, there's very little or minimal maintenance, and not have to worry about getting pregnant. The disadvantage to this procedure is that because they are doing surgical methods to prevent pregnancy, it may be difficult to reverse. So, for people who are wanting to have children or wanting to become pregnant in the future, this method is not advised. It may be expensive depending on the procedure. You would have to consider recovery time, and it will not protect or prevent against sexually transmitted infection. The last method of um, birth control is abstinence. Abstinence is not having any sexual intercourse where there is no contact between the vagina and the penis, and that there are no fluids shared in between the male and the female. Abstinence is 100% effective in pregnancy prevention. It is 100% effective against sexual transmitted infection, and there is no health risk. The disadvantage is that you will need a fair amount of self control and not be able to participate in sexual activity. This may be difficult to abstain from sex, and that your partner should be able to understand your decision not to have any sexual intercourse. This may be difficult, however, on some certain that you do not want to participate in sexual activity, then this is 100% effective in preventing pregnancy and sexually transmitted infection. And this concludes my presentation. Thank you so much for listening. These are the reference that I use in this PowerPoint presentation. Thank you so much and have a wonderful day.